Well, what did happen? That guy died. He committed suicide. Why did he do it? Well, he had mental problems. About that, we didn't know anything. They were inside. We probably could have seen them, but we didn't see. It's not like a broken bone if someone, you see it and you help him. We couldn't help this person because it wasn't visible for us. And the other problem is, compared to a physical disease, is that they don't talk about it. I mean, if you have, if something pains, you go to a doctor and he helps you. But this mental, in a case of a mental disease, you also have pain. It's incredible pain, but you don't go, it's, in our society, it's kind of a taboo to talk about mental disease because people feel uncomfortable when they talk about it. They just don't feel well, and people who have mental problems, they are afraid to talk about them because they think that the society won't accept them anymore. What is mental health? I mean, can you measure it? Like, if you have good blood pressure, then you're obviously healthy physically. But can you measure happiness? Or I mean, from what point on can you actually say that you're not healthy anymore, that you have a disease? I mean, every one of us is sometimes happy, sometimes sad. But when comes the point when the sadness is so big that it becomes depression, and that is already a disease that you have to treat? Well, it's really hard to understand it, but before we talk hours about it, we just have to know, well, yeah, mental disease, is it important? Is it important at all? I mean, all the last 3.5 days, we've been listening to keynotes, really good ones, important ones, but what were they be talking about? I mean, almost no one mentioned mental health, besides Mr. Bayer, just before, told that it's an important topic. So, and you recognize it's a devastating number. 1% of the whole population has schizophrenia. Well, is it that much? We have even more devastating facts, I think, from the World Health Organization. What does it mean? It means that, for example, the whole 400 million is the same number of people like the whole Europe is. 1 million suicides per year. I mean, in car accidents worldwide die about the same amount of people every year. And look at the last thing. 1 person in every 4th family has mental problems, has a mental disease. So what does it mean? For example, if we look at us here, it would mean that all the people in the first 2 rows would have someone in their family who has a mental disease. It's incredible. So that is a problem that really affects a lot of us. But then comes the question, what can we do?
Yes, what can we do? We, I mean, are we able to change anything in this world? Okay, now, let's do this. I normally don't say this to people, but just think back. How were you like? I mean, you were a baby. Well, cute. And then you didn't know anything. Like you were 0. There's nothing. But you're sitting in front of me. How? Education? Communication? So we think to make awareness about an issue, it's important to educate people. Then we were like thinking, what can we do, right? And then we were working in a group, as everyone did, and we presented like ideas. Everyone has different opinion about it. And there were like different kind of ideas. Like there should be a profession, mental support, like IT support. Or we should train ambassador so he can go and talk about it to other people. And there will be also like a coach who can lead them towards it. And there should be a software which can actually, with animations, which can explain what's mental health, why it's important. And then, of course, workshops in high schools. And further trainings for the adults and educators, teachers, so they can teach us the issue better. And then we thought, well, we always want the others to do something different, like teachers, like the high schools. But hey, we want to change something. And we are here to change something. Then we were sitting there, and then we just had this thought, if you want to see a change in this world, be the change. So we were thinking, the brains were working. Then we were like, what are we doing here? Why are we here? And then suddenly there was this idea, fantastic idea. And yes, I think it's time to present our resolution. This is it, study week. Why we can't have a study week about mental health? I mean, what are we doing here? Don't you think this was productive? And we learned so much about health, about prevention, about nutrition and water. Why not only about mental health? We have a study week. So what can we do? We have two main goals. Like we want to have enlightenment. Like we want to make, give clarification why it's okay to be ill, mentally ill. I mean, it's okay to be ill, right? But why can't it be like, if you are mentally ill, you are abnormal, you are not belonging to our society. So we want to raise awareness about that, and also spreading knowledge what's mental health. So what we thought was like a snowball system. I say to you, you go and tell it to your friends, family, classmates, and so it goes on, and the information, will be spreaded. And we hope that we can do these studies weeks, and we have a brief idea about it. It's like we want to have presentations about mental health, so inform you why mental health is important. And then there will be like workshops. There will be a coach who will teach you how to present about mental health and train an ambassador. And also there will be opportunity to visit a psychiatric hospital and have discussions with doctors, psychiatrists, and also with mentally ill people who are willing to talk about it. Important is that we have an insight of the research that will give you that you have a view about what this generation is doing for the future. I think the future of mental health is in our hands.
We already did something for its understanding. Now it's up to you to help us to spread this information, and please visit this website to see the results, the outcome of our week. Thank you very much for your attention.